Can you just compare for me how you would look or how you would execute working with someone like with a neurodegenerative issue like Parkinson's versus someone who has ADD?
Yeah, okay. So this is really good. So Parkinson's, they have obviously slowness of movement.
Hmm.
So sometimes we actually have a whole program um, called LSVT, and for Parkinson's long, big movements we have in our sensory program. So long, big, fast movements, they can really help. Obviously, the other thing we've seen is doing vestibular exercises, so head and eye movements. Those usually help a lot. Now, somebody who has the difference with that, so Parkinson's is a slowness of movement. So we want to have big, long type movements. We want to have faster movements. We want to use the vestibular system. That seems to help a lot. Um, with people who have ADHD, you have your lobes of your brain, so your frontal lobe, and the most lateral part of your frontal lobe is your prefrontal cortex. And a lot of times that's the area of the brain that needs to light up to calm the system down, to get them to one, to be calm, second, to attend and focus. And we usually use what has been very successful is we use an eye movement called an anti-saccade. Basically, if a target comes out, basically your eyes look in the opposite direction. And the reason being is when when a target is going to come out, your brain is going to want your eyes to move towards that target. So if your brain has to inhibit that movement, it has to concentrate. So it has to attend and it has to concentrate and it has to focus and says, no, I'm not going to go towards the target. I'm actually going to move my eyes opposite. Well, that takes a lot of attention, a lot of focus, and that lights up the prefrontal cortex. And that seems to help a lot. It's pretty interesting because that same anti-saccade, if a target comes out, your eye moves to in the opposite direction, seems to help a lot to with people who can have seizures, people who have strokes and have overactivity, and they have spasticity in the muscles. So we've used that with stroke patients. We've used that with people who have anxiety. We use that with people who have motor tics or seizures. So it's very interesting.
Yeah, absolutely. Absolutely.